guys. So this is going to be part 4 of my BRCA1 positive and mastectomy story. Part 4 is going to be my exchange surgery. So it's the second surgery of the 2, and this was where they took my pectoral expanders out and replaced them with silicone implants. So the timeline, just to recap from the last 3 videos, I made the decision to have my double mastectomy in October of 2019. The actual surgery was scheduled for February 19th, 2020. I was supposed to have my second surgery end of May, but because of COVID and the hospital system not having elective surgeries, which this is considered an elective surgery, they pushed me back, which honestly was fine. Having the expanders, while it's not pretty and it's not comfortable, it also isn't the end of the world, so kind of is what it is. So what happened in the last 2 weeks pre-exchange surgery, I did have to go have a COVID test the day before my surgery, where they just did a drive-through nasal swab. I got my results about 6 hours later, came back negative, so that was great. About 2 weeks ago, I had my pre-op appointment with just my plastic surgeon, and that's where we talked again at length about making sure everything is looking good. She did a physical exam, palpated and touched everything, and we discussed again the decisions that I was making, so having round implants, silicone, and then we discussed size. So she kind of looked at the size of my chest wall and just the shape of my body, and she estimated that she would go somewhere between a 250cc implant to a 325cc implant. And she explained that what she would do is in surgery she would open up my original incisions, but only about halfway. So my current open incision is about 3 inches. My actual scar from the first surgery is about 6 inches, so they only opened up about this much, which was great. It wasn't, I was expecting her to have to open up the whole thing, but she didn't. So she said that she would have multiple different sizes of the implants in the OR with her, and what she would do is she would open the incision, remove the expanders. She would have to release some scar tissue because I did have scar tissue buildup under my armpits and also kind of in the lower inner corners of both breasts. So she opened those scar pockets back up a little bit, and then she said they would sit me up on the table and insert implants and kind of see which ones looked right. So I kind of had a say, but at the other point, she's the plastic surgeon. This is her specialty. So she made the final decision on which implants to actually put in, and she decided on 300cc per side round silicone. So the surgery itself for the exchange was technically an outpatient. So we arrived at 8:10 a.m. The first hour of my pre-op was a lot of the nursing stuff, so getting vitals, a urine test for pregnancy, getting my IV in, giving me some Valium, having me sign my consent form, all of that kind of stuff. And then the second hour was where my anesthesiologist came in, my surgeon came in. I did have a medical student come and introduce himself, and anesthesiologist and my surgeon both kind of, went through some health questions, did some checks on my vitals, and then my plastic surgeon actually did all of the drawing on my chest with her little purple marker. So that was a pretty quick pre-op, I think. It goes by pretty fast. They then got me into the OR, and Marcus said that it was about, I think he said maybe 1 o'clock that they brought me into my post-op room. I faded in and out of consciousness quite a bit. They used a general sedation for me, so I don't really remember day of the surgery, post-surgery very well. But in order for me to leave, I had to keep fluids down, I had to go to the bathroom, and I had to be able to like walk on my own. So they discharged me around 3 p.m. and I think we stopped for something to eat. I don't really remember it. And then we came home and I putzed around the house for about an hour, and then I went to bed at 5 p.m. Sleeping was not really an issue. I think I still had quite a bit of sedative in my system, so I fell asleep and slept until like 9 o'clock the next day. The differences between this surgery and the last surgery was that with this one, I can sleep on my side pretty easy right now already. With the last one, it took about, I'm going to say 2 months to be okay sleeping on my side, but it still wasn't comfortable because the expanders don't move, whereas the implants are a lot softer and a lot more comfortable right off the bat. So another part for this surgery to keep in mind is that they may or may not do fat grafting. So for me, they did fat grafting, and what that means is they do lipo on some other part of your body, and then they take the fat from the lipo and they inject it in other, like around the breast tissue. So for me, they took a little bit of fat from my belly area, and then in kind of a C shape around the breast, so from the top to underneath, she injected. So you can't really see it, I guess, but with the expanders I had right here, I had dents where you could actually see my ribs. I still slightly have a dent right here, but they do some fat grafting so that you have a more natural slope, so it's not just like two melons like stuck to your chest. Gives them more of a natural shape, and just it looks a little bit more normal. And on the plus side, you get a little bit of lipo, so new boobs and lipo. 2020 is not so bad for me after all. In terms of this surgery and how I'm handling it, my stomach is still a bit tender where they did the lipo. I do have 2 small incisions at each hip where they inserted the whatever to do the lipo. Those are healing. No drains for this surgery. As I mentioned, my open breast wound, I guess, is about 3 inches on either side. It's currently taped still. They told me to leave the tape on for about 2 weeks. I do have pretty much full range of motion back. My pec muscles are kind of sore still, but that could be just from being manhandled in there. I took no pain medication. I took no Valium. I haven't even taken Advil or Tylenol for this. It's been very, very easy. So I do currently have 2 weeks off of work. They did tell me that the worst part about the exchange surgery was going to be my stomach where they did the lipo, just because there's a lot of fluid retention that can happen with liposuction, and the only other part that's a bit uncomfortable is actually the underside of the implants. There's quite a bit of bruising, but it's a green bruising. It never turned red or purple, and that's where she just had to release the scar tissue. So all in all, I'm doing really well. I'm healing very quickly. I'm excited to eventually take the tape off. Because I did go smaller, I have 300cc implants. She did say that mine will not really move or shift or settle that much. The larger your implants are, the more you can expect them to fall or settle over time, which can take months. But because mine are small, they're really not gonna do a whole lot. That's really it so far. I'm doing really well. I'm surprised at how quick and easy the second surgery was. I wish it could have been done months ago, but COVID, you know. I think overall, just to kind of sum up the last 6 months, I'm really glad that I did this. It was very scary to make this decision and to actually have it happening, the process, the planning, all of that. There was no one telling me what was going to happen, what to expect. There were like generalizations as far as what you could expect or what may happen with your case, but it's really hard to say when everybody heals differently, everybody handles pain differently, everybody has different surgeons, all of that. But all in all, I went into this really scared of not knowing what to expect, and on the outside, now that I'm through it for the most part, I think just having the weight of a breast cancer diagnosis gone for the most part, I think it's really going to improve my quality of life. Just my stress levels are down. It's not something that I have a constant fear of. I no longer have to have appointments every 3 months. I no longer have to have a mammogram. Once I'm completely out of all of the surgery, post-op and everything, I have a post-op appointment with my surgeon 2 days from now on Thursday. Today's Tuesday. And that's kind of it. I do have a yearly exam with my breast surgeon. I don't know if that's going to be every year, but I will see her this coming October. And then I really don't have much follow-up other than a 5-year MRI. And that's basically just to check and see if there's anything that they missed. There's always that chance, but having my cancer risk go from what they estimated between 65 and 80% chance of getting breast cancer down to 5% or below really just makes me feel good. It was the right decision for me. It may not be the right decision for everyone, and that's where you really need to ask questions, go to those appointments and have those consultations with surgeons, get as much data as you can, talk to anyone that you can, watch as many videos like this as you can, because there's a lot of data out there on statistics and cancer and what to expect, but there's not a whole lot out there that's going to tell you what you should do or what plan is right for you. That takes a lot of piecing together things that you've learned from all of these resources and really making a decision that's right for you. So I will be doing a part 5 kind of end to this whole series. I think maybe in like September. I kind of want to give my body a chance to adapt to this for it to become the new norm. If there's any settling, I kind of want to see what it looks like, give you a thorough review after I've broken them in. But all in all, I'm happy. I feel good. I'm confident that this was the right path for me. So